The morning show. Hey, I'm so excited this morning. I'm just excited about the information we about to get. I'm sure it's going to be some good news and bad news and some get ready news. And it's just an absolute pleasure to have you on the show this morning, sir. And thank you for putting it all on the front lines and working really, really hard to try to save lives. Y'all give it up to show your love for Dr. M.J. Collier this morning.
Yes, sir.
Hey, Dr. Collier.
Good morning, Eva. Good morning, Brad. Good morning, Special K Rock T, and all the morning show crew, and all the Rickey Smiley morning show listeners. We are so glad to be here with you, bringing you your COVID-19 coronavirus update for Monday, April 6th. At this time, United States, approximately 340,000 cases confirmed, and then 9,562 deaths. Now, remember what I told you previously. The death number is the only real number that we can actually count as a real statistic, because the number of cases identified is lagging far behind because of the slow rate of testing and the slow rate of test results. So at this point, we can probably add 30% to that number, and we'd probably be approaching more as to what that real number is. But that doesn't really matter. What matters, again, is the death rate, and unfortunately, that number is going to be climbing. We are in the week where we're going to have more deaths probably than we have. We're in peak week, as Rickey so eloquently stated. I like that term. But I tell you, Rickey, a lot of people must have had a lot of time on their hands in the last few days, because the internet is booming with conspiracy theories about 5G. And 5G.
Yeah, I was going to ask you about that.
It's the fifth generation of wireless telecom technology that your smartphone is on. Now, a lot of the people put that information out are on their smartphones while they're typing on the internet telling you that they found a conspiracy theory. So, and the reason that's most relevant is this is radiation, but it's non-ionizing radiation. And when people hear the term radiation, they become afraid because it sounds technical. But the word is not always negative. The radio is non-ionizing. It does not excite electrons or knock them out of orbit, which is what causes DNA damage, can cause things like cancer or develop, but it won't give you coronavirus. The two things are totally and completely unrelated. So let's knock down the Facebook post now. There were pages such as, "There's no COVID-19 out there. This respiratory illness is a result of exposure to 5G." And yes, I've been hearing that from many different sources, and the big cover-up is that they just want to dominate the world population. So when I see things like that, I'm like, oh my God. But this is totally irrelevant. This is totally illogical. Please delete it, and please don't forward it. I had so many people forwarding it to me this weekend. It was about to break the internet. So we want to be careful. As a Rickey Smiley Morning Show listener, you want to replace fear with facts. We want to make sure that you are well informed, and you do not have to worry about 5G radiation as any way being related to the coronavirus. Yeah, and so, and the way that it's really laid out, if you go to one of the websites, they make a reasonably compelling case about it, and supposedly an insider from the 5G developers is coming forward and testifying, etc. But some of those clips are put together from various quotes. Even one quote is from a book, and now you can research those sorts of things with your computer, and you find out somebody put together a message to try to stir people up. So relax, everybody. It's not 5G. You can still use your cell phone safely. Most of us have not upgraded to 5G anyway, so it's not even in a lot of the places that people are saying that that's it. So there we go.
Wow.
Now, the big news, Rickey, is that, again, they're talking about treatments, and the president came out and he highly supported the use of hydroxychloroquine. And amazingly enough, he's getting a lot of pushback. Now, there are doctors and scientists that are saying we don't have the research, we don't have the numbers. Rickey, that's absolutely ridiculous. We do have the research, we do have the numbers. That this therapy has been in use in Europe and China. It's been documented that it decreases and shortens the severity of the disease and shortens the duration of the disease. And I have had patients that have tested positive. I treated them with azithromycin and hydroxychloroquine, and they converted to negative in less than 7 days. So, and you're not supposed to convert.
Wait a minute,
Most
what?
people don't convert. They convert it to negative. Normally it takes 14 days minimum before you retest somebody and you get a negative test so they can come out of quarantine, go back to work, etc. But in my personal experience, treating patients with those medications, that combination of azithromycin or a Z-Pak and hydroxychloroquine, Plaquenil, the drug that's for malaria, and it's also used for autoimmune diseases such as rheumatoid arthritis and lupus. it has decreased the severity of the disease and limited it. But more importantly, it has shortened the duration of the disease. And I have conversion from a positive coronavirus nasal swab, the PCR testing, which is the most sensitive, to a negative PCR test in 7 days. So that is, that's pure science again. And most importantly, Rickey, it's the treatment regimen that every hospital is using. So they put you in the hospital, they put you on a ventilator, and they're using this medication. So, this is one time where, they really are going a little overboard, particularly on CNN and talking about this drug is unproven and it has side effects. It has a small percentage of side effects in some people that can happen, but it's a safe drug. It's FDA approved, and most people they take the medication with no problems.
Hold that thought, Dr. Collier. Can you just come on the other side right quick and finish that right there? Because I have a quick question. Dr. MJ Collier, y'all, and plus we're going to have you on the next hour. So thank y'all for listening to the Rickey Smiley Morning Show. Dr. MJ Collier, more coming up next. Now, we got Dr. MJ Collier in the building. Dr. Collier, I want to ask a question. So if somebody's being healed in 7 days, is that not a cure? And share your dose and the name of both of those drugs again.
Okay, the medications are a combination of azithromycin, which is an antibiotic, and they have been using this to treat viral infections for secondary bacterial infections for years now. They did one study where they placed anybody admitted into an ICU on azithromycin, no matter what their diagnosis was. They could be in ICU for congestive heart failure, etc. And azithromycin would shorten their course of time in the ICU and decrease their overall morbidity and mortality. And then, of course, the hydroxychloroquine, Plaquenil, it starts off as a malaria drug. That is the treatment that it is FDA approved for: malaria, rheumatoid arthritis, lupus, and other autoimmune diseases, because it causes and mitigates it's an anti-inflammatory effect that's focused particularly in the lungs. So it helps tremendously with those disease processes. So people didn't just make an educated guess on using that medication. It's been in use. Both of them have been to treat lung infections. Now, the other is remdesivir, which is an HIV antiviral drug. It has a particular pathway that it decreases viral replication, and so they're using that as well IV in patients. Normally it's an oral drug, but they're giving high doses IV, a 400 milligram dose the first day and then 200 milligrams for the next 4 days. Each of these drugs is only given to a person for 5 days. So if they test positive, they're treating them, or they're admitted to the ICU, they're treating the people. They put them on these drugs for 5 days, and it stops the infection from being as severe as it would have been. So it mitigates the path of the infection, but more importantly, it shortened the duration of the infection. And again, I have confirmation and documentation on patients that have been treated and they have converted to a negative test in 7 days. So this is nothing unique to my practice. I got that treatment protocol from the hospitals in my area that are using it. So again, it is out there. It is being utilized, and I don't know why all of a sudden there's a little pushback, and I don't know whether they're trying to control the supply line or don't want everybody taking it at the first sign of symptom that they think they have coronavirus and haven't been actually diagnosed with a positive test. But again, it's out there. It's being treated. And last week on Thursday, the FDA did approve the use of the hydroxychloroquine or Plaquenil in the treatment of the coronavirus. So it's in the treatment protocol. So that's one where I actually have to agree with some of the things that are coming from the president. He says that, what do you have to lose, was the quote that they have been rerunning on CNN. And it's not simply a matter of what do you have to use, it's what's in our treatment armamentarium, and those drugs are in our treatment armamentarium. So it's not unreasonable to use them. So, I anticipate that, several of the studies that they're doing will confirm this in the U.S., but once again, this is not new. The science has been utilized in China, is utilized in Europe, and Europeans do a lot of testing that, our FDA slows us down from doing and takes a little longer for the United States to get on board. But oftentimes, a lot of medications have been in use in Europe for years before they're finally approved for use in the United States because of our FDA process.
All right, Dr. Collier, let everybody know how you can be reached.
Okay, ask Dr. MJ on all social media, and I'm getting a lot of questions, and I try to answer those questions when we're live on the Rickey Smiley Morning Show because it's an overwhelming task. I can't respond to everybody's IMs, but believe me, I'm trying. I'm trying to
I know it.
So ask ASK Dr. MJ. And next hour, we're going to talk to you about the very important guidelines for wearing masks and why masks and what materials they should be made out of.
There it is, Dr. MJ Collier, y'all. We're going to be talking to more. We're going to have Dr. Collier to come on and give us more information in the next hour. Appreciate that, Dr. Collier. What you got coming up next, Gary?
Coming up next, y'all, the real Adrian Ballard. She's speaking out during quarantine time. We're going to talk about what she said up next. Rickey Smiley Morning Show.